It's time to talk about gout. We'll talk about primary and secondary gout, basically, and the morphology. So when we think about gout, we should know that it is genetically impaired metabolism of uric acid. And if you remember that uric acid is the end product of purine metabolism. What happens is that uric acid crystals, excessive amount of uric acid crystals accumulate in the tissue, and this results in recurrent episodes of acute arthritis, and there is a precipitation of monosodium urate crystals inside the joints. And so what would happen is there would be a formation of large crystalline aggregates, which are called tophi, and this would lead to chronic destruction of the joints and joint deformities. And renal injury is also included. We have to remember about the renal injuries. And it is more common in males than in females. As for primary gout, this is 90% of the cases, and there is an unknown enzymatic defect. But for secondary gout, which is 10%, there is a known cause of this, and it is hyperuricemia, which is the increased turnover of nucleic acids, for example, leukemias, chronic renal disease, increased intake of game and red wine, for example. So this may be, this is thought to be the cause of secondary gout. Let's talk a little bit about the morphology. First, acute arthritis. This can affect any joint, mostly in the hallux, and there is abrupt and intense pain. And the reason is thought to be the lowering of the temperature in there, perhaps. I'm not sure about that. As for chronic arthritis, there is a permanent precipitation. There is tophi, as described above, and inflammation. So you would see lymphocytes and histiocytes in this area. There would be destruction of cartilage, fibrosis of synovial membrane, and ankylosis. And we must remember that it also can affect the kidneys, and there are 3 forms. So in the medulla, affecting the papillae, and then there are tophi and even kidney stones. And tophi are formed in the vicinity of joints and in the bursa olecrani and the bursa preepitellaris auricle, and less frequently in the kidneys and other tissues. And we should also know that often these patients with gout are obese, and they have an increased risk of hypertension and arteriosclerosis. And remember that hypertension is also another of the disorders of multifactorial inheritance or polygenic. So unfortunately, those with gout may also have hypertension. And the clinical presentation of gout would be in 3 stages. First is an asymptomatic hyperuricemia. Second, acute arthritis, with attacks of acute pain from days to weeks, and then there are silent periods from months to years. And then the third stage would be the chronic changes, such as tophi, ankylosis, and in 20% chronic renal failure. And next we will be discussing monogenic or Mendelian disorders.